In Essential Task 9.2, we are going to discuss the major diagnostic category of psychotic disorders. This will begin a sequence of essential tasks that span between 9.2 and 9.9, where we talk about individual categorizations of psychological disorders and then denote all of the various disorders that fall within those categories. As you can see from this zoomed out preview of the upcoming topics, each of the orange labels, from psychotic to eating all the way up through personality and eventually neurodevelopmental, are the broad classifications of disorders. We're going to start all the way on the left with psychotic. Technically, there's only one disorder that falls into this category for our purposes, schizophrenia, but there's so much to talk about in reference to schizophrenia that we're going to devote one entire essential task to the topic. I will note both of these boxes are a little tall, quite a bit taller than what we've seen before. So if you see those two boxes and you think, well, I can do this horizontally, my recommendation would be to take the bottom box and move it over to the right so that your piece of paper has one on each left and right side, because each of those boxes are quite a bit long. You might be surprised when we actually get into it. But I'll allow you to pause the video here before proceeding into the concept map. So when we talk about schizophrenia, we're talking about the only psychotic disorder for our purposes. Psychotic disorders under this psychotic category means the patient has lost contact with reality. When we diagnose schizophrenia, it should be noted that the symptoms can vary. There's going to be a list of 8 symptoms for our purposes, and it's quite unlikely that a patient would actually exhibit all 8 of them. Symptoms when talking about schizophrenia are divided into 2 categories. There are 5 what we call positive symptoms, and in a moment we'll transition to the right side and talk about negative symptoms. I want to stress this point before talking about any of these, that in schizophrenia terminology, positive symptoms, that word positive does not mean good. It means something has been added to the behavior of the patient that is abnormal, that would not otherwise be there. For example, one of the common symptoms of schizophrenia that for our purposes is a real clear indication you're working with a patient that has a psychotic disorder like schizophrenia is when they exhibit delusions. Delusions are false thoughts, thoughts that are not grounded in reality. An example of a false thought would be, all politicians are aliens. Well, that's obviously not true. Another example of a delusion would be something like somebody dropping a pen in the room and saying, that pen involves me. Somehow the drop of that pen 45 feet away is related to me. Well, that's not true. For example, if somebody picks up the phone at a supermarket that you attend and you think to yourself, that person's getting a call about me, that's the FBI calling the supermarket to get me. Well, that's not clearly true. That's a false thought. That would be what we call a delusion of reference, when you think things in your environment are referring to you. There's also what we call delusions of grandeur, these really exaggerated claims, I am a god, or I am the greatest, I am the most accomplished person. These things, you might be confident in yourself, but a lot of times those are false thoughts. The second positive symptom are hallucinations, which are false sensory experiences. So I'm talking about things like hearing voices, seeing something that's not there, feeling something that's not there, reporting that you can see and feel spiders crawling up your arm when they're clearly not there. Those false sensory experiences are classified as hallucinations. We'd like you to watch the clip here attached. It's a really fascinating look at what it is like to experience visual and auditory hallucinations. In the context of this class, if any multiple choice question is referencing hallucinations or delusions, the only possible answer is either schizophrenia or the broad category of psychotic disorders. There's no in between. None of the other disorders that we talk about will be marked by these types of symptoms. If you were in class, we actually simulated to the best of our ability the effects of auditory hallucinations. So that's not something you can really do at home, but a demo that we did in class. The next symptom that's classified as a positive symptom is called word salad, or just disorganized speech. Word salad is sort of the nickname for disorganized speech patterns. If you watch the segments that I've parsed out here in this clip, I wouldn't watch the entirety of this, but if you watch that 4:45 to 5:45 region, you'll notice a woman who clearly exhibits disorganized speech patterns. She's in the middle of her thoughts, and then she'll say things like a China or somewhere that make no sense. She's talking about going to the supermarket. She's talking about interacting with people at the supermarket. And then seemingly out of the blue, in the segments of her sentence, she throws in this little phrase about like China or something. It doesn't make sense. It's really disorganized. It's almost like she took a bunch of words, she took a bunch of speech patterns and just shuffled them together, tossed it into a word salad, as they would say. There is another element of positive symptoms known as inappropriate emotional responses. One of the elements that you classify as a positive symptom is when something is clearly sad or disheartening, but an individual responds in a favorable manner and it really doesn't match. So, for example, you might tell an individual, unfortunately, one of my pets just passed away. Somebody then responds by laughing at you. Well, that's not appropriate. That doesn't really match the response there. Even if it's something like a betta fish, they should have some degree of sympathy. And certainly if it's a different pet, then obviously a larger degree of sympathy. Well, that inappropriate emotional response would be what you would classify as a positive symptom of schizophrenia. It should be noted that there are other disorders where that type of behavior might be marked. So diagnosing just off of this fourth positive symptom would not likely be sufficient. As we'll talk about in just a moment, we actually need more than that to actually diagnose. The last one that's classified as a positive symptom is called catatonia, or the catatonic state. This isn't super common, but you do see this with patients with schizophrenia. Catatonia, or the catatonic movement, are what we classify as movement abnormalities. Some of them can be very rigid. So you might have a patient who's kind of stuck almost as if they're paralyzed. They're not paralyzed, but their movement is very rigid or they're very resistant. So you might see an individual who's sort of curled up in a chair, and when you try and grab their arm, they're very resistant. Well, that movement abnormality of being in that rigid state is what we call catatonia. This clip here at the bottom, really great encapsulation of what catatonia or a catatonic state looks like. On the other side of the spectrum, we have negative symptoms. Now, negative symptoms mean that something that would otherwise be present in the behavior of the patient is gone. So that word negative means something has been removed. The first is being expressionless, exhibiting what's called the flat effect, where instead of expressing the opposite of the emotion that's appropriate, it's very flat. How was your day? It was good. Now, to be clear, that expressionless, what you might call the flat effect, could be something that would overlap with other symptoms of other disorders. But what should be clear here is if you see that expressionless flat effect with hallucinations, well, now we'll be more confident in a diagnosis of schizophrenia. I'd be the first to admit expressionless can be a symptom of other disorders. But again, it could be part of a broader diagnosis of schizophrenia if some of the other symptoms like delusions are present. The next is mute or toneless voice. And the third one is a diminished emotional response. So it's a little bit different than expressionless. So we are still talking about patients that are going to express emotions, but something really happy or exciting happens and their responses diminish quite considerably. It can be challenging to diagnose based on these negative symptoms. I'm going to be honest. A lot of these negative symptoms overlap with other disorders. And that's actually one of the things to consider when talking about schizophrenia. When we look at these positive and negative symptoms, into the DSM-5, again, the text where we look at all of these symptoms and all of these disorders, we find that there's a requirement of at least 2 symptoms, but positive symptoms are considered way, way more reliable. If you try and make a diagnosis of schizophrenia only on negative symptoms, even if there's 2, it's unlikely to be received without some type of opposition. People are going to be questioning, are you sure it's schizophrenia? Is this not a form of a mood disorder or something else? Now, if somebody's exhibiting hallucinations with one of the negative symptoms, well, that's 2 symptoms. And because those hallucinations, which are really a clear element of schizophrenia, are present, then we can be more confident in the diagnosis. So again, this point here is emphasizing something that I mentioned verbally a few moments ago. Positive symptoms on the left side mean that a behavior was added, a abnormal behavior is added to the life of the patient. Negative means an appropriate behavior has been removed from the life of the patient. I would like you to watch this clip here from 2:30 until the end. I think it really encapsulates schizophrenia symptoms really well. The woman in this clip is incredibly articulate. She can describe her symptoms with great clarity, something that certainly, clearly, as you can see, happens. But to the extent that she is able to, I think is really quite profound. It'll give you an interesting insight into schizophrenia and then trying to manage things like visual and auditory, and in some cases, somatic touch hallucinations. The other element of this is to talk about what might cause schizophrenia, what seems to influence the manifestation of symptoms. In terms of schizophrenia, there are really 2 broad categories: things that happen in your life environmentally, or things related to biology that might explain schizophrenia. The first is that individuals who have viruses during pregnancy are more likely to birth children that manifest the symptoms of schizophrenia than otherwise. Correlation is not causation. It will never be causation. And we are not going to test this theory by intentionally infecting individuals with viruses and seeing if they birth children that someday in the future manifest schizophrenia. But there is a positive correlation between viruses during pregnancy and schizophrenia. There is some belief that viruses or virus-like agents might have some type of role in the manifestation of symptoms, that potentially, perhaps, there is some type of detrimental impact on the brain's development in the womb that doesn't really quite manifest itself until later on. It was not stated previously because we only really want to talk about symptoms, but I should note, just for clarity's sake, the symptoms of schizophrenia typically manifest in your later teen years. So the onset of hallucinations and delusions might not happen until you're 15, 16, 17 years old, making it a pretty strong belief that brain development has a close connection with schizophrenia, and that potentially something might happen in the womb when the mother is pregnant and is exhibiting the symptoms of a virus that then in the future will affect that child while their brain is actively still developing. Another theory, another idea is called the diathesis stress model. There also seems to be a connection or correlation between child abuse and schizophrenia. If you remember back in Essential Task and Diet 1, we cited the diathesis stress model as this idea that your genetics and your real-life stress together determine whether or not you exhibit symptoms of a disorder. Well, obviously, child abuse is an incredibly powerful real-life stressor. If your genetics suggest that you may or may not be vulnerable to manifesting the symptoms of schizophrenia, coupled with obviously a really intense real-life stressor, that might in and of itself combine together to explain the manifestation of symptoms. Because again, the diathesis stress model basically argues your genetics need some type of real-life stressor to tip the scales in order for you to manifest symptoms. Maybe child abuse is that type of real-life stressor that seems to be connecting. Again, should also note, not a guarantee, not saying that every individual that exhibits schizophrenia has exhibited or undergone child abuse. That's certainly not the case. Just part of our discussion, part of the possible explanations for schizophrenia. When we proceed onward to the right side of this, we'll talk about some of the biological elements of schizophrenia. These ones I think are especially important because in order to understand how we treat schizophrenia, it's really important to understand the biological elements. The first, and this one is huge, the brains of patients with schizophrenia seem to have more receptors on neurons that are sensitive to dopamine. Dopamine levels in the brains of patients with schizophrenia is much higher than those in the brains of somebody without schizophrenia. Dopamine is the neurotransmitter that we talked about back in the previous unit attached to pleasure. It's active in our reward pathways. Not exactly positive why this might be the case, but it seems to be that heightened levels of dopamine connects and might be an underlying cause of the schizophrenia symptoms. We are so confident of that, and this is a preview of later, but I nevertheless want to make this point now, that the primary means of treating schizophrenia through pharmaceutical drugs is to prescribe antipsychotic drugs that reduce dopamine activity. And as a matter of fact, many patients that use antipsychotic drugs actually report a total elimination of symptoms like hallucinations. A patient can go from hallucinating every day of the week to hallucinating never again, totally dependent on the presence of an antipsychotic drug being in their system. So this connection of dopamine and the potential of dopamine causing these hallucinations and delusions is pretty well defended, though I should also note, in addition, so the and progresses here, in addition to heightened levels of dopamine, there are also brain abnormalities structurally in the frontal lobes of patients with schizophrenia, at least according to PET scans. PET scans are one of the brain imaging techniques that show brain activity specifically. We actually see lower levels of brain activity in the frontal lobe, the prefrontal cortex particularly. The frontal lobe and the prefrontal cortex is the part of the brain responsible for high-level cognition and thinking and planning and decision-making. Well, when we combine these two things together, we might get a better sense as to why patients with schizophrenia exhibit delusions. We have heightened levels of dopamine and an inability to really process and go through that coherent judgment and decision-making that would otherwise be present due to lower activity in the region of the brain responsible for that high-level cognition. When we combine these two brain chemistry, biological reasons, we might be able to solidify some of the possible underlying causes from a biological perspective as to why individuals with schizophrenia experience some of these symptoms. The last, and this one's really important too, schizophrenia is one of those disorders where hereditability or genetics seems to play a massive role. If one identical twin has schizophrenia, it's almost 50-50 that the other twin will also manifest the symptoms of schizophrenia. It drops down under to 20% for fraternal twins, and then certainly quite a bit lower the less two individuals are related. Also note here at the top, the overall population is 1%, which means any random person in the United States has a 1% chance of manifesting the symptoms of schizophrenia, which it means it's probably more prevalent than you might anticipate. That means every year at Apponequet, there's approximately 7 students that manifest the symptoms in the future. Every graduating class, there are 2. I typically have over 100 AP Psych students, so every year, on average, there is 1. So it's more prevalent in society than you might anticipate. One of the elements of the diathesis stress model, though, just to emphasize this point before we end our concept map, is that genetics and real-life experiences determine if you end up manifesting the symptoms of the disorder. In the case of schizophrenia, it seems like genetics plays a huge role in that it might not take too much of a real-life stressor due to the fact that the genetic similarity in manifesting these symptoms is so profound.